back pain, and that is a very general term. So what I'm going to try to do today is I'm going to try to go through the different issues that create back pain. And I've kind of isolated three topics or three main issues that contribute to back pain: the structural, the kidneys, and menstrual cramps. And if anyone knows of another one, I racked my brain trying to think of something else. But those are the only things in that quadrant that can really make the back seize up and hurt. And structural, of course, covers the spine and slip discs and wrenched and sprung and all that kind of stuff. So I can't think of anything else that would actually contribute to back pain. When we get done with this, if somebody has something that I didn't cover or that they don't think fit in with all this, go ahead and we'll toss that around too. Okay, so let's start with, we'll start with structural. That's a biggie. Okay, the structural, of course, is anything that has to do with holding the body up. The muscles, the spine, the spinal cord, the muscular structure, anything like that. If you've got a wrench, let's just start with a scenario. You've wrenched your back. You tried picking up something too heavy and your back has been wrenched. So the first thing that you're going to want to do there is apply a little M&L salve, that topical antispasmodic. Hot and cold is really great. Doing your hydrotherapy, if you don't have any good M&L salve or something like that, get immediately in the shower and do hot and cold. What that's going to do is that is going to bring fresh blood into the area and calm it down, calm the spasm down, and get oxygen back in there, get the circulation going. And quite often that can greatly improve a sprain or a wrench. My husband, as some of you may know, is 6'4", and he has a really long back, and there have been many times that poor man doesn't know he's not 19 anymore. And he will go lifting and hauling stuff, and he lifts with his back instead of his legs, and he doesn't have his belt on. And a couple of years back, he comes in and he's laying over my desk and he's just barely holding himself up. And he says, I have really messed it up. He had been moving some wet wood. So he had gotten some wood from Lowe's and it had gotten rained on and it was all wet. And he was hauling this wet wood around and he had just wrenched his back. And so it was just a 24-hour episode for being that bad. We rubbed M&L on him, put the BF&C pack on his back. He drank the BF&C internally. That was Thursday. By Sunday, he went out there and moved the wood, and he was good as gold. It was over. So you don't have to, there are things that we can do herbally and that you can have in as first aid to protect against that. All right. Now let's look at ruptured disc, arthritic spine issues, anything like this. All right, where you're looking at the cartilage is affected. And excuse me, it's just humid. I live in North Carolina, if somebody doesn't know that. It's always humid here. So when you're looking at the cartilage issues, if you go the medical route, they're going to tell you that once the cartilage has been degraded, there's no hope. You just got to get your spine welded or whatever the heck they do to it, and you're basically handicapped for the rest of your life. I hate to contradict those people with all those degrees, but that ain't necessarily so. I have seen people in wheelchairs with arthritic spines that could hardly move, could not stand up on their own. They were in pain constantly. And in 6 to 8 months, they were moving, walking, doing just fine. And what we did, the program was you clean out your body, of course. All of these things are assuming that you are doing the foundational programs, okay? All the suggestions for healing your body assume that you are keeping your bowels open, you're boosting with your echinacea so your immune system can deal with all that die-off that you're creating. And there will be die-off because you're going to be sloughing off inorganic, minerals and all this stuff that's the arthritic issues in the spine. All that has to be cleaned off, adhesions, those things have to be dissolved. So you are going to be creating some die-off, even though it's not like toxic, like from your liver. There will be die-off being created from healing an area. Excuse me. So echinacea is important. And when you're just doing a simple program and we're not looking at infections or horrible inflammations or things like that, you can probably get away with doing an ounce of echinacea 4 days each week. That's like the minimum just for basic cleansing, basic work. So you would do an ounce of echinacea like Monday through Thursday and then take 3 days off from it. And that would probably support you unless you're going to get into your liver flushing and kidney flushing where you're going to be doing serious work, then you probably need to go to 6 days a week. But, and then of course the nutrition. None of these programs, nothing is going to work to rebuild your body if you don't provide it the raw nutrients at cellular level for these master herbs to work with. So the bone, flesh, and cartilage formula, the arthritis and rheumatism formula, these herbals have the nutrients in them to knit the body back together. And but they cannot do it. They do not carry with them the copious amounts of nutrition needed to do the work they're capable of doing. You need to be providing the nutrients at cellular level. Is that making sense to everybody? Okay. If you are not intaking the nutrition, then the herbs will go through. They're going to take down some inflammation. They're going to do some work in you, but you're not going to have the healing that you really want. It may still come, but it will be very drawn out and very slow in coming if you're not providing the nutrients at cellular level. And that isn't all that difficult. It's fresh juices. You leave off the cheap food. You do not eat processed foods. You eat good, healthy, whole grains, beans, nuts, seeds, all the good stuff that's out there. You learn to enjoy that food. And a lot of us, we have to retrain our palates to enjoy this kind of food. But the big one is the juices. Get your fresh juice every day. Get that juicer going and drink your fresh juice. That goes straight in. It's available at cellular level within 15 minutes for your body to use that to rebuild you with. So don't discount that. So that is the foundational program, making sure the bowels are open and functioning well, boosting with echinacea and your nutritional intake. Once that is there, then we can apply a program directly for healing the back, okay, for strengthening and healing painful issues in the back. If it's structural, you're going to want to apply packs with the bone, flesh, and cartilage formula, along with taking that formula internally. Now, the BF&C, bone, flesh, and cartilage, abbreviation is BF&C. Yes, the Champion Juicer is good, but I like the Brevel. Anna asked what juicer that I recommend. I like the Brevel because it's got the biggest chute, and you can get bigger stuff in it without having to cut up so much. But the Champion is also really good. So either one of those, I've used them both over the years. So, you're welcome. Okay. So what we want to do is you're going to need to be making your pack. This is now, when you make a salve pack, you are generous with what you put on it. Now, I've got quite a few videos on there already showing how to put a salve pack together. So I'm not going to do one today. But when you make the salve pack, you're going to lay it on your piece of press and seal wrap, and you make it big enough so that it passes your spine by a ways. You're encasing the spine or the affected area in the salve pack, and you've got enough press and seal around it. The press and seal is put out by Glad Wrap, and it will adhere to the skin. So your skin needs to be clean and dry so that it will stick to the skin. And once you've got that on there, that pack will stay on all night, and you don't have to wrap yourself around. It will just stay right on the spine. And what this does is it saturates those tissues with the nutrients. So when you do a pack with the salve, you are taking the nutrients that rebuild and debride the issues. The herbs in this formula will dissolve inorganic mineral deposits and adhesions. And it also has the nutrients that can actually rebuild cartilage. Now, I know that's impossible, so whatever. But it's just amazing what I've actually seen happen over the years. And they still say that it's impossible. Okay. So this will do it, and you put the packs on, and it will saturate the tissue so that you're getting the nutrients right there at ground zero where they need to be to heal the area. Okay, this is critical. And then you do not want to discount the hydrotherapy. You leave those salve packs on overnight or 4 to 6 hours during the day. You want to give yourself at least a 2 or 3 hour break every day from your salve packs. Otherwise, you will oversaturate the tissue with oil and you'll break out in oil bumps. So when you are using the salve packs, you want to give the body time to absorb all that oil and process it in where it can breathe freely for a while so that you can continue to do it. I've had people that were getting so much relief from them, they just left them on 24/7 for weeks and ended up with bumps where they had to completely go away from the salve packs for a while, which was not great. Yes, Genevieve.
Can you hear me?
Yes.
I don't know what happened to my screen. So what about when your flannel or your wool is saturated so badly? What do you do with that?
You're talking about for repeating the salve pack the second night?
Yeah. Like, you know, if you have to do it several times and it gets really, really soggy and saturated.
What I would do, I would take the top piece off and lay it on top of a fresh piece.
Okay.
And that way you're refreshing the top piece and you still have a little adhesion there so it's not sliding off the press and seal wrap.
Okay.
So yeah, I know what you're talking about. And I actually had to do that with my knee when I was wrapping my knee the other day, the second time around. And so you're asking me a question of something I just figured out.
Yeah, I was wondering about it.
Yeah. Yeah, that's one reason. Go ahead, Dawn.
You can reuse your flannel packs.
Yes, when it's on your knees or your back for 5 to 7 days, you would toss it out if it develops an odor or a stain.
Do you keep it in
mostly, no, you can just fold it up and put it next to your bed inside of a Ziploc bag.
Oh.
So when you get up in the morning, you just take the whole pack with the press and seal and everything on the back, and you just fold it over and slip it inside of a Ziploc bag. And then at night, when you're ready to make it again, you peel it off that press and seal that you have, lay out a fresh new piece, lay that on it. And like she was just saying, it's so oily. What you might want to do is take the top, because you have 2 layers of flannel there. So take the top flannel piece off, and you might fold the second one up and put it in to use it on another day, you know, when this one gets so bad that you don't want to reuse it. Take that off, and then put put it on a fresh piece, and then set that on the press and seal again, and now it will stick to the press and seal because you've got an unoily piece on the bottom. Okay. The piece on the bottom is fresh and clean, so it will stick together. And I had never thought much about that. I usually just struggled through and got it on there somehow, and you know, made it work, you know, with the press and seal the second night. But it is a hassle because it's so oily. It doesn't want to stick to the wrap anymore.
One more quick question. Can you do that with the liver flush then? Reuse your packs or not?
Yes, the castor oil packs, I would say 3 to 5 days. Okay. With the same rule applying. If it develops an odor or a stain, you throw it out and start over. Okay. Yes, Genevieve. You got to turn yourself on. I can't hear you.
What is this?
Say that again?
I understand what a stain is, but what is a stain? Is it the discoloration of the flannel completely?
You'll notice it when it comes up. It will be, yeah, it's going to be, yeah, it'll be a little darker, a little off. Yeah, the only time that I've really had it where I wanted to throw it away before I thought it was ready was when I was putting it on my feet. And I tend to not reuse the ones on my feet too much, maybe one day, you know, maybe 2, because your feet, you're throwing so much waste out through your feet all day long. So reusing when you're doing it for feet issues, reusing the pack on your feet, you'll just have to really judge that tight.
Okay, but it is a different, I mean, because, you know, my flannel can get the same color as the salve. Mm-hmm. And that's okay. But it's with the feet, I found also that it gets darker, and I thought, I wonder why this is darker.
That's probably, I would say that's toxins that have come out.
Oh,
I would throw that out.
So can you do a foot toxin bath? I mean, can you really do you know how you do foot baths and they pull the toxins out? Can the bee pull it out too?
I don't know how that's going to go as far as, I mean, it's good to get the toxins out, but I don't know that that's going to help with, you know, the tendinitis, the inflamed tendon and all that you have there. I've never seen anybody get relief from a foot soak, you know, a detoxing foot bath when their feet were inflamed. I've never seen it help anyone. The only thing that's ever really helped is the BF&C or the hot apple cider vinegar soaking, you know, that kind of stuff. Because that the apple cider vinegar, by the way, will dissolve the urea crystals in gout and take the worst of the gout away.
Okay.
So that would be those 2 things. But I've never seen a foot soak take care of an inflamed tendon.
Okay.
All right. So let's talk about a real strong program. I'm going to assume that somebody is wanting to get rid of an arthritic spine, that they are in serious pain and uncomfortable and they can't bend and move and their spine is just stiff. So what is the program going to look like for an arthritic spine? I would say, pardon? Okay, I would say that you would do your foundational work. You would be applying your packs, and you would probably want to do an ELF at least once a week. You know, for a basic program, once a week to do an ELF, And I will tell you this, I've got plenty of examples in my own body. After I tore my knee up, it got really inflamed and it was like on fire. It hurt so bad. I could not step on it. And this was years ago now. And it was just like a fireball in my knee. And I was icing it and doing everything. And I was working with a chiropractor that is a member with us. And he was telling me, we can't even strengthen that till you get the heat out of it and all that. You know, you've got to get the inflammation out. So I'm going along. I've got my General Naveen now, and I'm working on trying to strengthen it and doing the BF&C, but I've got the heat out of it more or less, and I'm going along. And I just have a really bad day, and my knee is just really hurting me. So I decided, you know what, I'm just going to do a liver flush. And you know what? It was like, I got up in the morning and it hurt really bad all that day. I'm trying to remember because this is like 10, 15 years ago. We weren't calling it an ELF back then. It was just, I went on a week of liver flushing, but I did a big liver flush that day. And by that evening, the pain was like 70% gone. I mean, I went from needing to walk on a cane to being able to walk straight without any support with one liver flush. And I went ahead and I stayed on the detoxing program for a week. And by the end of that week, my knee was right as rain. So it is amazing what getting the toxins out is going to do for the pain. So don't discount liver flushing and detoxing. This is just a testimony that getting the toxins out, doing the liver flushing work is going to do a lot for relieving pain. Don't discount the ELF or the week of liver flushing when you're dealing with pain issues. And when you're doing the work of restoring yourself, even though you're not necessarily toxic, the liver still needs to be able to filter really well to get the toxins out, the stuff that you're cutting loose and getting out of your body. So on the program that I would say for a structural issue like this, I would say at least an ELF one time a week. Pick a day in the week and do an ELF once a week. And the difference between the ELF, somebody asked me earlier this week, what's the difference between an ELF and a liver flush? The ELF is just the process of clearing the waste out of your liver. It's an overnight procedure. Emergency liver flush is what ELF stands for. And it's just a process of getting the garbage out so that the liver is free to pull in waste more effectively. The liver detox, the 5-day detoxing program, you're using the herbs and the nutrition to actually detox your body. So you're supporting the liver while you're using the herbs that are going to be cutting waste loose and killing off the bad stuff, to say it very elementary. So the difference is one is an actual detoxing program. The other one is a flush. It just clears the liver out. And if anyone has any questions on that, and I need to clarify more, I'll be happy to. But that is the difference between them. So once a week, just get that liver cleared out. Just dump it and get it cleaned out. And then you do want to do your week of detoxing, because the detox formula and all that are going to help purify your blood, purify the tissues, and get the waste out of you better. And then, of course, you want to use the bone, flesh, and cartilage formula. This is the formula that is going to knit your body back together. The BF&C, you can take that every 3 hours. The day that I tore my knee up, I took a tablespoon every hour all afternoon. I say that simply so you know you can't really overdose on the stuff. You can waste it, but overdosing on it, I've never been able to manage it myself. And my knee never swelled up. I was never completely off of it, and I heard it rip. When I hit the floor, I tripped over a dust buster. My husband was putting down a floor, and of course, I was trying to clean it up as he went, and I tripped over the dust buster and came down on my knee and just tore it sideways. and the inside tendon ripped. And that was back in back probably in 2004 or 2005. And once you mess with your knees, once you tear those things up, your underpinning is damaged and it's a weak spot. And I've had nothing. It's like my life before the accident and my life after. Before, no knee pain. After, constantly working to keep my knees healthy. So protect yourself. You do not want to fall and tear your knees up. It's not worth it. Okay. Oh. All right. The other thing that we want to talk about is the hydrotherapy. I know I was talking about it in the beginning, but I didn't get that on the tape necessarily. The hot and the cold. 7 hots and 7 colds. When you get in a shower, if you're dealing with any injured part, your back, whatever, you do 7 hots and 7 colds. You get in the water, you heat your back up, you let it get really, really hot. And when I used to do my back, I would kind of go until my stomach got a little sick, you know, from just the extra blood. And you're getting so much heat in here that it can kind of make you a little nauseated. And then you just turn it completely cold and it just slams all that blood through the blockage. And a good analogy for what you're doing with the hot and the cold, you don't have to stay until you get nauseated. That was just me being stupid. But what you're doing with your hot and your cold is the hot brings the fresh blood to the surface and the cold slams it deep. So whenever you think of it as firing a blood bullet into the damaged area, whenever you have disease or injury, you have blockage. And the blood is not able to get through the damaged area, through the blockage into the damaged area to take out the garbage and bring in the nutrients. So it doesn't do any good that you're swallowing all this great stuff and that you're doing all this wonderful stuff for yourself if the blood cannot cycle through the damaged area. And that's where hydrotherapy comes in. You load the bullet with the hot water. The hot water loads the gun, loads that blood bullet, and the cold water fires it. So the more drama between the hot and the cold, the more intense the change between hot and cold, the harder that blood is going to slam through the blockage and the more effect you're going to have. So you do your hot, you get the area all pink, all hot, all bloodied up there where you can really know that it's hot. And then you just take and move the water away. You turn it completely cold. Or if you really want to be dramatic, have a bucket standing right outside your bathtub or shower with ice in it that will come up above your knee if it's your legs. If it's your back, have a bathtub with some ice in it outside your shower and go plunge into the ice tub. That is going to do it. But you can't do that every time. But an ice plunge is wonderful for when you're really having problems or just to treat yourself once in a while. And it is a treat. Once you get past the initial shock, you're going to love what you did to yourself. But an ice plunge, you can have your shower and then fill the bathtub with water, put 10 pounds of ice or whatever in there and go from the shower into the bathtub. And you'll be singing a song to the Lord, I tell you. It really gets you going. And then you get out of there, you go heat yourself back up, you go back into the bathtub again and get in there. And I did that one time. I was so swollen. I had edema so bad. And this was probably 20 years ago or better now. But the top of my feet had just had big pockets of fluid on it. And I was doing everything. I did my kidney flushes. I did all that. Nothing was getting rid of those pockets of fluid on my feet. I hadn't seen the bones on top of my feet in months. And it was really bad. And if you all don't know, kidney issues is one of the things that brought me into natural healing. I grew up serious kidney problems. So, but they're pretty much under control now. But anyway, so we went and rented a honeymoon cabin in Pigeon Forge, Tennessee. And outside the master suite there was this gorgeous hot tub. And inside was this heart-shaped bathtub. We bought 20 pounds of ice. We dumped it in the bathtub, filled that with water, turned the hot tub, cranked it up. And I was going between the hot tub and the bathtub. And by about the second change, I was spaghetti. I was cooked. My husband was practically carrying me between the two of them because it was like somebody had put a latex glove over my body, and I could feel the fluid moving underneath the latex glove. It was just like the movement of the fluid was so intense. I mean, this was amazing stuff. And you just feel your whole body, the fluid is just moving in you. And the next morning I got up and you could see bones on the top of my feet. The fluid was absolutely gone. There were bones sticking out the top of my feet, and all the puffiness everywhere, it was completely gone. It had completely cleared, but it was pretty dramatic. The one thing I can say for the good of that was after the second change, I was so numbed out, I didn't feel the heat and cold changes anymore. The first time was the hardest. Getting into the ice water the first time was the rough one. But after that, you're so numbed out, you don't really feel the changes. Yes, I think it will work on lymphedema. Anytime that you have swelling or something like that, I would try this. And if you have that issue, tell me how it works for you, because that could have very well been lymphedema that I was dealing with. And I never go to doctors. I just try to figure it out. And so there's a good chance that it would work. I would definitely try it. It would be my want. And it's pretty dramatic stuff. And of course, if you are dealing with something like that, you want to do your real intense kidney flushing stuff too, to support the work that you're doing. So any questions on, missed one thing. If the back is inflamed, if the bones are inflamed, arthritic inflammation down the spine where you've got a lot of pain, you want to use the arthritis and rheumatism salve before the BF&C. That will take the heat out. That salve is all about dissolving the urea crystals. And when you have a hot inflamed joint, you have urea crystals that are in there inflaming the joint. And the A&R stands for arthritis and rheumatism. And that formula has the herbs in it that will dissolve those urea crystals. So when you pack it over a hot inflamed joint, it just dissolves the urea crystals and the pain just falls off. It may take a couple days in a bad situation, but it really is helpful. And we have the formula. Dr. Christopher, he says that, most of his formulas can be made as salves as well as tinctures. And, if there would be some reason to apply them topically. And so we make this as a salve. We also have it as a tincture to drink. So once you've got that down, you can go ahead and use the tincture in a separate cup, but you can take it in the same day with the BF&C. So you're taking the herbals internally to prevent the inflammation from coming back and to prevent more urea crystals from inflaming the joints. So you can use that at the same time that you're using your BF&C. Any questions on that?
Yeah, I have a quick question.
Sure.
Yeah, I have a really old injury from getting hit in the face with the ski lift. But so if I'm going to use that on the back of my neck where the base of my head hits my neck, how would I get that to stay?
Press and feel. Yeah.
Even
now you put it. Yeah, and what you'll want to do is just pull your hair up. Pull your hair up and get it out of the way, wear it under a cap or something so that you've got that free there. Okay, and you've got gorgeous long hair, and that is not something that's easy to deal with, but you can get it pinned up or whatever, and just wear it up overnight. And and then put the pack on around your neck. And if it's inflamed, if it's hot and inflamed,
Yes.
use the A&R to start with. And once you get that worst of it down, then you can start rebuilding with the BF&C.
Even if it's like a 25-year-old injury?
I had someone who worked for me years ago, and I don't have permission to say her name because I've never asked her for it. She had a whiplash issue, and it was like 10 years old or whatever, and she had horrible headaches and just real bad pain. And she did the BF&C, the M&L, and the BF&C and all that, and completely cleared that up. And it was a really old issue going on. And I do have the testimony of my shoulder. When I was 18, my boyfriend and I were horsing around, and he fell on me, and my shoulder went into the ground and ripped. And that was when I was 18, and I was in my early 30s before maybe my mid 30s, when I discovered BF&C. And when I started taking it initially, I was taking it for my back, because I'd been in the car accident and messed my back up. Well, I wake up one morning and I can't lift my arm. I've got pain shooting down my arm. I can't hardly lift it. And I called my mentor at the time, and I said, I think I'm having a heart attack. I don't know what's wrong. And she laughed at me. She laughed at me a lot back then because I was a ding dong. And she had the presence of mind to ask me if I had ever injured my shoulder. And I said, well, yeah, like when I was 18. And she says, well, what's happened is, and I had adhesions. My fingers would be numb. The arm was weak. It had healed very poorly. And so she explained that what happened was the BF&C, even though I was using it for my back, it went in there and it dissolved the adhesions in my arm. And it took it back almost to the day of the injury because it had healed so poorly. So I had to wear a sling for a week or so, a couple of weeks. I wore a sling. And then my arm now is just as good and as strong as the other one. I mean, I have no more numbness, no more nothing, problems in my arm at all. It's as good as the other one.
Okay,
so it was just the BF&C will go in there and it will find old injuries and clean them up. If you faithfully use that one, it's going to remind you of anything that ain't right. I've had some people say, well, I don't want to use it if it's going to be doing that to me, but do you really want to have those issues? It'll clean up, dissolve the adhesions, clean up the inorganic mineral deposits, and just go through your body and clean house. But you need to support the process. Okay, so
Dara?
that is, yes.
The and my notes are in the other room right now. The A and what is it? The arthritis. What is it? The A and
A&R. Yeah, it's arthritis and rheumatism. Staff.
Do you put that with the BF&C salve?
No,
separate?
no.
Like
You have to do one or the other.
Okay.
No, that you
Okay.
have to pick one or the other. You can take them both internally at the same day in separate cups. You know, you do not drink it. They're complicated formulas, so you do not drink them in the same cup. You would have a cup of BF&C and then a cup of A&R, about 10 minutes apart or something like that. But they're too complicated to take down together, and they're very different in what they're doing. So no, the BF&C, if you want to throw your calcium formula in that one, that's fine. It's got all the herbs for the calcium formula already in it. That just adds octane. So you can, put your calcium formula in with your BF&C, but I don't know anything you can put in with the A&R, except maybe you can mix almost anything with your echinacea. Whatever dose of whatever you want to take with that. Echinacea is very simple, and whatever you put in with it, you can pretty much, whatever you need to take, throw it in with your echinacea. That is doable.
What's the rule of thumb then? Again, just before we move on, because I want to make sure I'm clear before we move on. So the
Okay.
A&R versus the BF and C, how do I know? Because I have the arthritis in my neck and you have me doing the BF and C packs, but
Mhm.
how do I know when the A&R is appropriate?
When you'll know it because you'll be
For
hurting.
inflamed? Yeah.
Yeah, it's for inflamed conditions. So you just hang on to that. And as the toxins are coming out, if you don't keep up with your ELFs and you don't keep up with your liver detox so it can suck all that waste out well, it's going to get inflamed on occasion.
Yes.
You know, it doesn't mean that it isn't working. It means it's working really, really well.
Okay.
And your body just isn't able to get all the waste processed out well enough, so you reabsorb some. And you don't want to do that.
No.
So,
Okay.
yeah, it's for the inflamed issues. It does not have the properties in it overall to knit the body back together. The arthritis is all about dissolving the adhesions and taking the inflammation down.
Okay. Okay.
That makes sense?
Thank
Yes,
you.
Genevieve?
How many, how much of the dosage of the tincture do you take?
Oh, the dose?
Yeah, the
Of-
doses that you take, like in her situation, she's using.
Well, for an average sized person, it would be a teaspoon per dose. And
How many times a day?
the BF and C, I would say every 3 hours. The arthritis and rheumatism, I would say 3 times a day.
All right.
And,
I
you know,
usually
if
do it
you
3
feel
times
you
a
need
day.
more, use more.
Yeah.
Say that again, Anna.
I generally found for me 3 times a day. If I do it more than that, I kind of get, I don't feel, it's a little too much for my body. But
Yeah,
that's
you
just,
start getting a headache and feeling a little off.
yeah.
Your body isn't able to deal with all the die-off you're creating. So you want to hold the formula down so that you can be comfortable with the rate of healing that's going on in you, because that waste has to process out. And if it goes out, if you're cutting more loose than your body can process out, then you're going to reabsorb that. You're going to have headaches and swellings and whatever backlash symptoms that you tend to get.
Yeah.
Anything from being crabby to hurting.
Mhm.
So that would be the backlash. Any other questions on the structural stuff? Okay, so let's move on to the second reason for back pain, and that would be kidneys. The kidneys are located in the back, that's in that quadrant, and when they become inflamed or you have kidney stones or anything like that and the kidneys are inflamed, they're going to make the muscles around them spastic. The muscles are going to spasm. It's going to give you a serious ache in your back. And honestly, I have had, over the years of my life, I have had to figure out what it was, because I had the menstrual cramps, I had kidney issues from my early years, and then I decided to get in a car accident and wreck my back. So when my back would go into spastic issues, I had to figure out what was causing it, which one it was. And I found ways of doing that, of ruling out and ruling in which issue was causing the back to spasm and to cramp, and then to deal with that. Okay, if you're trying to rule out or rule in kidneys, that it's your kidneys, your back is just aching. For me, when I could ignore it all day long. I mean, I could go through the day and ignore my kidneys and just be busy, and you know, I'd be drinking and doing good, but there would be that ache in my back. But during the day, I could just not think about it. But when I would lay down to sleep at night, my back would just pulse and ache, and you just want to crawl out of your body and crawl into somebody else's. It just was so uncomfortable. You know, not to the point of writhing in agony, but to the point of being miserably uncomfortable, and you're not going to sleep. And here's what I would do to stop the pain. Usually within 45 minutes to an hour, I could be comfortable and fall asleep. And this is going from probably an 8 or 9 on the discomfort scale. We're not talking pain scale, we're talking discomfort. To me, pain is jabbing. You know, when I talk about pain, a fireball, a jab, you know, something that just radiates out. This is more like anyone who's had a baby, you know, the contractions and all that, the cramping that comes from labor. That was what would back labor. My daughter introduced me to what that was. And so what I would do is there were 3 drinks that I would drink. The first one, I would do an ounce of echinacea in a big mug, 16 ounces of fluid. I would set up an ounce of echinacea. In another cup, I would set up a tablespoon of herbal antibiotic. And in my third cup, I would set up hot lemonade with a full teaspoon of cayenne. I would drink those one right after the other. No time in between, just get one down and then drink the next one down. I drank all 3 of those, just one right after the other. You never put them in the same cup together because the fluid is also important. So you're drinking for the fluid as well as for the nutrients that are in it. When those begin to filter through my kidneys, it takes about 45 minutes for all that to hit the kidneys and start filtering through them really well. When they would filter through, my kidneys would just calm down. It was just like they let out a sigh and they stopped hurting. I mean, I would just sit up in the living room, turn on the boob tube, and just rock back and forth and just hold the controls. And I'd be rocking back and forth after I drank it, just waiting for it to stop because it would hurt so bad. And in about 45 minutes or so, it would just ease off and then it would be gone. And I could just go crawl back into bed and go to sleep. And then the next day, it's time to start the infection work. You know, you take your echinacea, your herbal antibiotic every 2 or 3 hours and clear it was a kidney infection, clear that up.
So Tara, excuse me, you said it
Yes.
was a tablespoon of lemon, did you say?
No, the second drink,
Yes.
that was a tablespoon of herbal antibiotic.
Oh, okay. And then the third drink
was hot lemonade.
And how much water with each drink?
16 ounces. Each drink is between 16 and 20 ounces.
Okay. Thank you.
No problem, my dear. So that is for an inflamed kidney infection, anything like that, that will calm down the spasm. Of course, you can rub M&L salve over your back to calm the muscles down. It's not going to stop the pain, but it will stop the muscles from spasming so bad. There's you know, no substitute for those 3 drinks hitting your kidneys and going through them. And then, of course, you go into the infection work and you do your infection protocol so that you clear the inflammation from your kidneys.
Excuse me.
And yes.
And with each drink, it's a tablespoon of the cayenne, a tablespoon of the herbal.
No. The hot lemonade is 1 teaspoon of cayenne, a tablespoon of apple cider vinegar, lemon juice to taste in 16 to 20 ounces of water. And if you're not diabetic and you don't care, you can throw maple syrup into that.
Okay.
Which tastes pretty good. And it is a cold drink. We call it hot lemonade because we put cayenne in it. This is not a hot drink. This is a cold drink.
Okay, similar to what I'm drinking for the liver.
No, for your kidney flush.
Okay.
Yeah, no, this is not the liver flush drink.
Oh, this is the kidney. Okay. So
But
Yeah.
but I wake up in the morning and do that in the morning. Right?
Yeah, that's the drink that you drink every morning just to give your kidneys a good flush in the morning, and it's a wonderful way to start the day. I drink mine nearly every morning.
Okay.
I don't want everyone to think I'm superhuman. I do forget it on days, or I look at that glass and go, I really don't want that today. I can't stand to drink it, but it's circulation. It supports the kidneys. It cleans the filters, which are your kidneys are filters. It cleans the pus and sediment out of your kidneys, all that good stuff. So yeah, it's a good drink to drink every day. And if you're prone to kidney stones, it will prevent them from forming.
Can you use cayenne powder, or do you have to use the tincture?
The tincture is actually better absorbed, I think.
Okay.
I mean, that's my personal opinion. If you really, really want the powder, try it. I mean, but in an emergency, I would go for the tincture. I mean, if somebody's having a stroke or a heart attack or something like that, I would not trust the powder. I would want tincture on hand. Or if you're dizzy and thinking you want to pass out.
Okay.
Vertigo. You want tincture. It works fast.
Much better.
Yeah, it's quick. Okay, so when you're doing the infection work for the kidneys, you know, clearing an infection and inflamed kidney, you would want to do an ELF. You would need to ELF in as the infection program calls for it. Depending on how intense the work you're doing, you'll be doing an ELF once a week, every 3 days, or every day, you know, for 5 days, depending on the intensity of the infection work that you do. And that's all in the infection protocol that's on there. So you will be needing to ELF for that. Okay, the other reason, of course, is kidney stones. And if you are having kidney stones, you will want to do the intense kidney flushing program, where you make the stone dissolve thing, and it sets on the counter for 24 hours, and then it takes 2 days to drink it all. You drink 4 ounces every hour, and that will dissolve the stones and get them out of there. And you can do those back to back if you need to. Also, that is a really good protocol if your blood pressure is spiking. You know, if it's gotten spiky from all your detoxing and all that, when you're cutting all those toxins loose, if you haven't supported it well enough, it can block up your kidneys, and your kidneys can be affected with sediment and pus, and that will cause your blood pressure to start spiking around, because your heart's having to push really hard to try to get the blood filtered through those kidneys. Kidneys are filters. There's no bypass around them. The blood has to go through them. And when you're detoxing really well, if you do not support your kidneys, if you're not doing your hot lemonade, if you're not doing any kidney flushing or whatever, the width of the vessels in your kidneys are about the width of a hair of your head. So when you're getting pus and sediment into, take a look at your hair, pretty thin vessels. It's about the width of a hair of your head. So if you are getting pus and sediment into your kidneys, your heart is having to pump really hard to get the blood through those backed up kidneys. And that can cause your blood pressure to spike up. So if you are living a good life, eating good food programs, all of this, and suddenly your blood pressure starts going a little wacky, do the big kidney flush. You know, just flush those kidneys through, and see if that will not clear up the blood pressure issues. Quite often it does quite a bit for that. If not, then of course there are herbal supports that will help. And also watch your sodium intake. That's really bad on the kidneys. Okay, so any questions on kidneys for back pain, clearing issues with the kidneys? Okay. The third reason for back issues, of course, is menstrual cramps. And I tell you, that can be such torture for females and women, and the other half of the population has no clue what we put up with. one of the, of course, the foundational stuff needs to be in there. If you're dealing with teeny boppers, make sure that they're getting their red raspberry tea and their blessed thistle tea. They can drink that fairly freely. That is going to help them form the hormonal. It provides the nutrients to form the hormones that they need for that change for them. But for the pain, for the discomfort, cramp bark is wonderful. Your cramp bark extract and the antispasmodic. Those two are absolutely wonderful for knocking out the spasms. And the female formula will help you with your clockwork. It will help with regularity and the intensity of the flow and all that other stuff. Usually within 2 or 3 months of using the female formula, you'll find that your timing is good, the flow is normal, and the cramps have greatly relieved.
Is the female formula used every day during that teenage life?
The female formula is used every day except for the 5 to 7 days of your cycle.
Right. So when if a teenager has problems, then they might as well plan on using the female formula for a while.
Yeah.
Okay.
Yeah. And usually, especially with the food program and all that. And another thing to remember, if you are stressed, if you take an emotional hit, you have just wiped out all your hormones. Your hormone levels are now on the floor. So if you are in a very stressful situation, if you take, something bad happens in your family and something has just broadsided you, you can count that your hormone levels are on the floor and all that's going to be all messed up. So one of the best things that you can do is make sure that you're taking your female formula, and there are other things. I've got a video out there on the herbs to support emotional first aid, I think is what I called that video, where I deal with what you can do to support the body for that kind of stress, because those kind of emotional hits can actually make you very ill, make you very sick, if not kill you.
So this emotional, I'm going to say emotional trauma, that's even for older people that don't have a menstrual.
Yeah, it is. Everything just goes flat. And the hormonal food formula is still available, the Change-Ease, the hormonal food formula. The female formula, I use that. After I went through menopause, a couple years after, I went through a real stressful period, and I started trying to flow again. I started spotting. And I called up one of our members who is a nurse, and this is one of her specialties. And I just asked her, I said, what the heck is going on? And she explained to me that when after menopause, when the ovaries and all that is shut down, the only thing that produces any estrogen at all, and we still need a little bit, is the adrenals. And when you are going into adrenal failure, the adrenals put estrogen on the back burner. And anytime that you have a serious drop in estrogen in your body, you will cycle. So for an older woman who is under serious stress, if she is trying to spot or bleed again, she's still got all her equipment and she's able to, that would be a really good clue that she needs to support her adrenals really seriously.
And she's going to support her adrenals with just the female formula or any other formula?
Well, the female formula is what she would want to use for that, but the adrenals are fed with licorice root.
Okay.
Licorice root will give the adrenals a free meal. And it's got the steroidal support that will feed them. And the adrenals want something to eat every 5 hours. So it's really good. And then she gave me a protocol. She had me on 3,000 milligrams of vitamin C 3 times a day, a time-release vitamin C. The adrenal support formula that we actually make. It was the one that she uses for her people too. And that has a lot of support for, it's got the ginsengs and all that stuff in it that helps you have energy without draining the adrenals. And then of course your kelp, which will provide energy without the adrenals having to produce anything. So it gives them a rest. And then of course the licorice root, and the licorice root is separate from the adrenal support because you want to know when you're taking that. So
What do you think of the licorice fruit?
I always did a teaspoon at a time.
And is this something like every day?
I did it a couple times a day. I think I did 2 doses a day for probably 6-8 months that I was doing a real strong program, and I took my vitamin C and did the adrenal support formula, and it came back. I quit spotting and all that just went away, and it rebuilt, and I haven't had any issues. That's been almost 10 years now. So, and I'm still here. I ain't died yet, so I think I'm doing all right. That's my big goal in life. You feel good, you look good, you're fine. You know, you don't got to worry about the rest of it, because if you're really paying attention to yourself, to your food, to what you put in your mouth and what you're doing with yourself, you can know how you're doing. You don't have to be constantly terrified that something's going on inside you. You live responsibly.
Okay.
Yes. Okay. So, any questions on this, or any? I think most of us here, the menstrual issues are not a big one. It's the kidneys and the structural issues. So, okay, well, people, we will get together in 2 weeks, and somebody just walked in here. I let her in anyways, but I'll get this video up, and it will be available in a couple days on my YouTube channel. And in 2 weeks, we will do a class on lungs and breathing issues.
All right. Thank you so much.
Thank you.
Tina.
Thank you.
Everybody have
Thank
a
you very
You guys
much.
take
Enjoyed
care,
it.
hun.
Good evening.
All
everyone.
right.
Okay, everybody have a great evening.
You
All
too.
right.
You too. Bye.
Bye.
Bye-bye.